Welcome to
Urban Beginnings.
a podcast about navigating urban planning and its impact on community. Hello, everyone. Welcome back to Urban Beginnings. Today we have an episode with Cruz. We'll be talking about social determinants of health and how it kind of cross paths with urban planning. Um, it's a pleasure to have Ellie here. We kind of cross paths in social media. I was scrolling through TikTok in the Urban Beginnings page, and I saw someone talking about food and relating it to urban planning. One of the biggest things in urban planning, which is redlining, decided to hit a follow. You know, I reached out to him saying like, I appreciate him sharing so much knowledge and relating it to other sectors. And so now we're here. So, Ellie, welcome. It's a pleasure to have you here. Can you please introduce yourself?
Yeah, hi Rogelio. I'm glad to be here. My name is Cruz. I have a background in nutrition, and I am actually currently working for a program called 18 Reasons, and we serve food insecure areas, and I'm a program coordinator there with them. And on my free time, I also record videos in regards to social determinants of health and how they relate to like food insecurity, food injustices, zoning, redlining, and a lot of other different factors that we don't really see on social media. And yeah, my focus is definitely food injustice. And you can't really talk about food injustice without talking about like, the different environmental factors that come into play that affect like low income families and communities.
For sure. So, I would like to start off just a little bit reading what the Office of Disease Prevention and Health Promotion kind of defines what social determinants of health are. So just give me 1 minute. I'll read that real quick for our listeners, and then we can dive into our conversation. So, what are social determinants of health? Social determinants of health are the conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. The social determinants of health are grouped in 5 domains: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Um, so yeah, with that being said, Ellie, can we just start talking about um, that?
Yeah, I think like that's a pretty long definition, and it does encompass like everything, the majority of things that do affect people's health. I like to keep it short and just say, like everything in your environment that affects your health, right? Like your overall health. And this could be your job, your employment, the your housing. It could be like the parks near you. It could be the grocery stores near you. Anything that can potentially have a big effect in your overall health is what I define as the social determinants of health. And it really is something that, it's really not talked about a lot, especially, social media. And that's my goal. That's the goal of my page, to kind of like spread awareness about all these different topics. Um, a lot of people focus a lot more on like nutrition and like food injustice. But like I said before, you can't really talk about one without talking about the other, because we're all affected by them. And even if we don't realize it, we are affected, you know? So thank you for reading that. It does bring, it makes it like more specific as to what we refer to as the social determinants of health, because a lot of people don't really know what it defines.
Yeah. Um, yeah, Blair, do you have any comments?
No, I
Uh,
think, I really appreciate your definition, everything in your environment that affects your health. I'm thinking on a personal level, like, transportation and justice, people not having access to transportation to like potentially get to healthcare clinics, or not having them, in their neighborhood. And so, yeah, I think that definition, while simple, like it really is far reaching. So yeah, I appreciate what you've put together for us, what you've
Yeah.
presented for us, that is.
So, Ellie, I kind of want to focus on a lot, or focus on a little bit on like housing. I know Blair is, more like transportation, but active transportation. And so, in some of your videos, you mentioned a lot about zoning and redlining, and the importance of, like, the space and environment people grow up in. Um, I know, and I'm saying a lot here, but just kind of, you talk a lot about also like food deserts, right? And and so, with that being said, I, as a planner, right, we're always kind of, um, like, for example, we influence with, obviously, community, driven efforts, right? Like, inclusive and, kind of exclusive or exclusionary zoning. And so when we talk about like zoning, obviously we can go back in time and talk about those times about redlining, and
Mhm.
which also had other impacts, like, for example, mortgage, right? Mortgage loans to people of black and brown colors. But kind of keeping it more of the physical environment, with like exclusionary zoning, like, it's direct impact to social determinants of health, because with zoning, right, it determines like what type of buildings, what type of, pretty much, amenities can go into a neighborhood. And so, with that being said, how important do you think like open space is in certain neighborhoods for us to practice, or being healthy, and continue to, having communities be, get more educated on, continue or being healthy, so,
Yeah.
yeah. Mhm.
Yeah, so that's a super long, but like it's a really good question, right? And there's so many things that people don't realize when it comes to just having a park nearby. And you mentioned zoning and you mentioned redlining, and I live in Oakland, right? And the majority of my life I lived in East Oakland. I came here when I was like 13. I live in East Oakland, since then. I'm 30 now, right? And one thing that I've noticed is, yeah, like, the green spaces. There's like such a lack of parks, even like, like gyms, like indoor gyms. There's really a lack of like sports complex facilities. There's a few basketball courts, a few tennis courts, and usually those are like, overcrowded with like garbage. And so people can't really go and exercise. They can't go and, walk, right? And, people don't realize that not having access to green spaces or like parks does affect their health. Um, and Oakland, we have North Oakland, we have East Oakland, West Oakland, downtown. And when you look at the differences in the neighborhoods, it's like between like East Oakland, West Oakland, and like North Oakland. The differences is so great, when it comes to like green spaces in North Oakland, you have, a better walkability. You have like groceries close by, you have like more green spaces nearby. So people feel more comfortable, walking to a park, because it's also safer. Compared to East Oakland, people don't usually walk to a park because they might not feel safe. So that right there, it kind of makes it difficult for people to engage in physical activity. And one of the points that you brought forth, the redlining, even though, redlining might not be something that people, kind of look into nowadays, it still exists. And, even though like these laws were set, in place like a long time ago, we're still being affected by them like greatly. And people don't really realize it. Like East Oakland is a neighborhood that's, the majority is black and brown folks. And, it's also one of the areas that has like the highest, like chronic disease rates, right? Also, it has like the highest homelessness rates and like food insecure rates. So when you look at the Alameda County map, you'll be able to kind of like relate all of these different issues together, like the walkability score, the green spaces, the amount of parks. And then it kind of makes sense to you how like a lot of, chronic disease usually increases in these neighborhoods because people don't have the access to these green spaces. They don't have the access to, like parks where they can exercise. And people usually just stay at home, right? Because if you don't feel safe in a park, you're not gonna go. Or like if you don't have a park nearby, you're not gonna go. And another thing that I've noticed too is a lot of the parks that we have, they're not being taken care of like properly. Um, if you go to these parks, like you have like the kids area, it's like run down. The slides are old. The swings are like about to break. Like the grass is high. Like they don't really take care of them as they should. So it's not even welcoming, right? So we'll have a park and the park is not, what it's supposed to look like. And yeah, like zoning, redlining, all that has a lot to do with it. And we're being affected by it so much, and it's all part of like a bigger issue, which is, systemic racism, right? And I had this comment on one of my videos of a person that said that, they don't believe systemic racism exists. And I feel like, just because some people don't get to experience that, it doesn't make it not real, right? Because there's other people that are experiencing it. They're going through it. And even though they can't put a label to it, like that's really what it is, systemic racism. And we're basically, paying like the price for the laws and like all the rules that were set like in the past. We're paying for that price right now. That's the result that we're seeing.
Yeah. I worked in the Tenderloin for a really long time, and the Tenderloin has significantly less open space compared to other San Francisco neighborhoods. I think it's like 0.17 acres or something per 1,000 residents. I don't know exactly how that compares to other neighborhoods. I feel like it's like 6 acres or something like that per 1,000 residents, if I'm not mistaken. And so, what sort of makes this like a major kind of public health issue for me is that, so you mentioned, folks, if they don't have open space, they're staying in their apartments. The Tenderloin is a very dense neighborhood. It's predominantly apartments, single room occupancy, hotels. And so people, if they don't have open space to go and play and gather and, be with community, they're oftentimes 4, 5 people, you know, doing that in like a small studio apartment. And so we've seen a lot of times just really what that does for their well-being, right? It's like there is no outlet for them, and then outside the environment is it's sort of a containment zone, if we're going to really kind of simplify things. But so there's a lot of challenges for that community, but I think a lot of it goes back to a couple years ago they really worked hard to renovate a park, and it's become like a really strong community hub for the people. And while it's just a start, it definitely has made a difference for them. And I think like we really need to strongly acknowledge, the importance of open space. And like you mentioned, gyms. I think there's maybe one gym in that neighborhood, but that lack of access, and whether it's, related to zoning or just other factors, it really has done a lot to impact that community, right? And so there's a lot of work to be done, but yeah, I just can't reiterate enough at the end of the day, like open space has so much value for community.
Yeah. And I was just gonna add another thing too, that I did notice, more like, community organizations doing. It's they're creating like community gardens, right? And that's also another important thing that we got to think about when we think about green spaces, because it does provide, some type of like produce, or like, like they're teaching like some kids like how to farm basically. And I think that does provide like a great resource. But at the same time, the farms that they're creating, they're super small because there's not enough space, and they're very like, like it's just really small, so it's not going to be able to like provide food for a big amount of people. And but that's another thing that definitely needs like more attention as well.
Yeah. I would like to thanks for bringing that up, right? Ellie, like access and also like keep up and preservation of places or spaces, so people feel either safe, welcome, and I guess some sort of like ownership or belonging in those spaces. I would like to kind of talk a little bit about, just like something that's been happened in the neighborhood where I grew up in Los Angeles, which is like a little bit. It's called like green gentrification, right? So green gentrification usually it means like when they add more maybe healthier options or more green spaces to a certain community, and usually like in certain areas it can cause displacement of like lower income residents. Um, and I know like every neighborhood is different, and I'm particularly talking about West Adams and Baldwin Hills area. There's been parks there for a very long time. Access to them, like growing up, we had to cross like railroad tracks. It was very unsafe. Walking through main arterial roads with like sidewalks that are very, very small and again, very dangerous just to access those. And so now they're making, they're improving these access points, right? And so, but I'm just a little bit worried because this neighborhood has, in the past maybe 5 years, a lot of the neighbors growing up have been displaced. First of all, because mostly there were renters. Just the lack of options for the actual community that were kind of born and raised there are not being really taken in consideration when projects like these come into neighborhoods. And so, I'm a big advocate for like community benefits plans that can give that option. Obviously, you can't keep people there, right? But also giving them options to maybe, like for example, if they're business owners there, if this area is becoming a little more popular, maybe protections on like rents, and other things like that. And so, yeah, I just want to talk a little bit about green gentrification. That it's a real thing. You know, and so like, we gotta, like, as planners, I think, or anyone kind of working in this, right? Like we always like we bring improvements, but also like, are we also aware of some of the consequences that could bring to this neighborhood, right? Like we're bringing access to them, but are we protecting them so they don't not displaced, so they can actually like they can actually enjoy these improvements? Because usually like landlords or whoever it is can see like, oh, they're improving the neighborhood, I can raise my rent. And sometimes these families, they're on cost burden already. So yeah, I just want to say that and see, maybe get your guys' thoughts on if you guys ever experienced anything like that, or just what are your thoughts on like green certification and like displacement of communities?
I think yeah, that's another thing that it's happening in a lot of like low income areas. And yeah, like it just reminds me of like the term gentrification, right? And but this time it's just more in regards to the green spaces. And like in East Oakland, we have like a lot of neighborhoods that haven't had any access to like parks in so long, but now they're building new apartment complexes and they're trying to clean up, and that's because it's not because, they want to cater to the people that already live there, but they want to cater more to the people that they're trying to target to move there, right? And yeah, like, it has to do a lot with the money. It has to do a lot with, kind of like gentrifying the community, right? And like I lived in East Oakland like for so long, and I started to notice like a change in the population that lived there.
Hmm.
And I was just like, okay, like I've never seen people walking their dogs before, like now. I've never really seen people like jogging like now, or like people on bikes. And it's because like a lot of different more people are like coming into the community. And you mentioned rent, right? That's increasing, the rent is increasing, like different things are happening, like the streets are getting paved, they're getting remodeled. They're setting up like different things on the sidewalks for people to walk. So there's a lot of changes coming, but I feel like, it's mainly because of the new population that's coming into, the community, not really because of the community that was already there. which kind of, it tells you a lot about the people that we have in power, the people that are leaders, that, they're really not worrying about, the black and brown communities, because they could have said this stuff in place a long time ago, but they're only deciding to do it now because they want to cater to, different folks to come and live in those areas.
Yeah, I just wanted to say really quickly, it's like all about looking at the benefits, right? And then the unintended consequences. Adding parks and improving streetscapes and, enhancing like air quality can bring much needed benefits to community. Reducing urban heat, improving mental health, and all those things are benefits that come from building parks and recreational spaces in these communities. And so I think when we talk about green gentrification, it is probably pretty like location specific at times. And also it's like, that adage, like build it and they will come, right? Like, so who are you trying to draw to these public spaces? And so does it have capacity for everyone? Does it have, was it built with community in mind? But yeah, I think like a really deep like benefits and unintended consequences like analysis for this topic really is required, because I think with so many neighborhoods, just lacking open space and green space and community space and all these things, it's really important to dig our heels into like, you know, do these benefits outweigh maybe increases in rent? And I know that's like a not a great comparison, because a lot of times that can happen what feels like almost overnight, right? Like rents or new buildings are being built, not keeping in mind, that we need more housing for low income folks and not, moderate income folks. So yeah, there's a lot to like unpack there, but I'm always really mindful with this topic. While I can think of like parks in Bayview, Hunters Point that are drawing a lot of attention and people, I think that neighborhood needs a lot of attention right now, and so there's so much to sort of think about when we talk about this issue. But I can also think very easily of places where green gentrification has absolutely happened, and it has really changed the cultural landscape of neighborhoods and places. So yeah, it's complex. I feel like we're always talking about complex things, and the overlap with urban planning and nutrition and all these things is like vast.
Yeah. Cool. And so now like, thanks for you guys' insights. And so I kind of wanted to talk a little bit more along those lines, right? Social determinants, access, green gentrification, and and based on my experience, when I do work, like obviously there's different lenses, right? You can see the big picture, and sometimes when you're looking at the big picture, you don't really see like the domino effect that can kind of lead into like smaller like neighborhoods. And so I always try to work backwards, seeing like identifying possible like areas of a city, or specifically where I work at and where I grew up. Like I think we should focus a lot on like neighborhood, like more community oriented, like more smaller scale. Um, because in reality, like these people are at most vulnerable when it comes to demographic changes and even like in development. And so I just wanted to bring up a little concept that I don't know, Ellie, if you saw. We did a informational video on community land trust, and I think this is a very good. I would consider it a tool for a neighborhood, because land trusts are typically they're nonprofits, community, like you can say community based organizations that acquire like land, and steward
Mm-hmm.
like to benefit truly their community, with emphasis like of long term affordability, again access and stability. And so community land trusts really it's a very powerful tool for neighborhoods, because it preserves culture, it preserves, for example, it can enable certain families to build generational wealth, depending on if a certain asset is in a community land trust. Like for example, let's say a community land trust purchases a single family home and they sell it to a qualified buyer, which is a formula that they kind of generate when they're formed. Whatever, let's say, whatever. So they own the asset, which is the actual building, but the land is owned by the community land trust. So it is a home ownership opportunity, but the land itself is a lease between the homeowner and the community land trust. And this is the whole component of keeping affordable homes in perpetuity. And so, with that being said, let's say a family decides to move out, right? They want to sell the home that they purchased through the community land trust. So let whatever, and again, it can vary, but most likely these formulas encompass that whatever money that they put in and whatever value that asset kind of gained through the time they live there, they take that money with them and can help them purchase a home maybe in other areas of a city that have more accessibility to, for example, food, like green spaces, more access to healthier foods, and even just education. And another component about a community land trust is that I think we all kind of appreciate is education and providing tools to those neighborhoods on getting education on like how to work their money, and how to get proper, or maybe even like how to use computers and all that things. And I can even say that I know some community land trust also bring in the health aspect of it, and provide like more material. Like there's more than just one like a clinic. There's also you can qualify for you know proper medical attention, things like that. And so yeah, I just wanted to bring that up and see if maybe if you guys were familiar with any community land trust, or I don't know. I know that was very high level explanation of community land trust, but just kind of see what your thoughts were behind that.
I'm not too familiar with the community land trust, but it does remind me of a there's a coffee shop in Oakland. Um, I forgot the name of it, but they rent out this big big space, and they have apartments on top of them, right? So it's like a three-story like building, and they rent out like the coffee shop is in the at the bottom, and I think they rent out the apartments on top, and they're the ones that own the whole building, so they kind of like set like their own rent, and I think they rent to people who are like low income. So I'm not sure if that's what you're referring to. I'm not sure if that's what it is, but I always try to find out more about it, but like I never could, but I was like, I think that that's what it is now that you mention it.
Yeah, I think I read an article on a coffee shop. I forgot the name, but yeah, there's coffee shop at the bottom and housing on top. So I think that's a great example of like community assets and community really trying to help their own people out, right? To maybe while these quote unquote green improvements are coming in, for example, for them to stay and even also enjoy those new improvements. So yeah. Yeah, I mean, just I guess I also wanted you to talk a little bit, Ellie, about your expertise. I know we've had some interactions in social media. We I know you were talking. You posted about food, Elisa. Dios mío.
Elitist.
Yeah, elites. Excuse me. So yeah, I don't know if you can talk a little bit about that, just because I really was able to relate with that post, and like when I reposted it, I really did talk about how it made me understand a little bit more about certain situations or when I was growing up. Sometimes like people were trying to shame me for my mom using WIC coupons, or
Yeah.
instead of eating Rice Krispies, the branded one, eating I don't know crispy rice. And also, if
Yeah.
you can touch a little bit on like, I guess how that can lead to like food anxiety, and
Yeah.
Yeah. So
Yeah, so I love to talk about like, food elitism and all the sorry. Yeah, I love to talk about like food elitism and how it affects people, right? And people are like, okay, like what is that, right? What is food elitism? And you can see it on social media all the time, right? You have like all these influencers showing you what they eat in a day. And it's like, okay, like for breakfast you have a smoothie bowl, for lunch you have like a salad with chicken, and then for like dinner you have like a steak with asparagus and mashed potatoes, right? So people tend to have this idea that you have to eat that way every day, right? And when you think about it, for some of us that have experienced like food insecurity, like that's something that's really not possible, right? And then you have other people on social media also like, talking about, quote unquote, like clean eating, and they promote eating organic foods, foods that are like non-GMO, food that is pasture raised. So we have this idea based on social media that we have to be eating this certain kind of foods to be healthy. And that's what food elitism is referring to, right? This idea that you have to have this type of diet in order to be healthy, but in reality, you don't, right? Like because some of us are not in that same place as them, as those social media influencers, right? We might not have the same amount of time. We might not have access to the food that they're having access to. And it's like you were mentioning that, you grew up with WIC, so you might have grown up, eating a different type of food than these people. So this food elitism basically is creating, this idea that if you don't have this food, then basically you're gonna develop chronic disease. And, a lot of us are basically like, we have this anxiety about food nowadays that where we go to the store, we think of all the ingredients, we look at the food label, right? But we don't look at it in a healthy way. We look at it in like, okay, like if this food item has such and such, like that means I shouldn't get it. I shouldn't eat that. And then we try to opt out for, something that has less ingredients or something that might be organic or, that has like a marketing label that's sold to us by social media. And in reality, a lot of those other products, they don't really have like the differences in nutrient composition. It's not really that big, right? For you to be like, okay, like if I don't have this pasture raised meat compared to, or like, this grass fed like beef compared to like a beef that's not, grass fed, right? Um, there's really not going to be a big difference in your health. And this has led a lot of people to focus more on like expensive food items because they're like quote unquote clean, right? And they kind of like left out, items that might be accessible and affordable to them or that might be within their budget. And yeah, like a lot of people do develop eating disorders because of all the stuff that they see on social media. And there's, a lot of research saying that, at least like 2% of the nutrition information that you see online is accurate, and basically like the other percentage is just like it's basically misinformation. Um, and that's the things that we as like nutrition experts or like public health professionals kind of try to fight against. And it's a lot of this misinformation that goes around. And it's very difficult because most of the stuff that you see online is just, misinformation, and it's being spread by people who have no background in nutrition. They don't have any expertise in the field. And it's mainly people who, they Google something, they read the headlines, and they go off of that, right? But it's people that, these people don't do any research. They don't, dig more into, what they're talking about, right? So right now there's a lot of fear against seed oils. There's a lot of fear against, food dyes. People say chemicals too, to kind of like demonize certain foods. They also use words like processed to also spread fear against certain foods. But they don't really specify, why these foods are bad for you. They just try to use all these different buzzwords to get you to, to get you afraid of them. But in reality, a lot of the foods that we consume are safe. And one thing that I love to promote is, the idea that, you can eat all these different kinds of food, right? Add a variety of nutrient food into your plate. And at the same time, you can also have like things that you enjoy and you love. right? For us as Hispanics, I was born in Honduras. A lot of the food that we eat is like demonized by a lot of this different, social media wellness influencers, right? They're like, okay, you can't have a tortilla, or like you can't eat like certain bread because this and that. But in reality, like there's space for all of that. There's space for you to have like the pan dulce that you like. There's space for you to have those tortillas, the tacos, or whatever traditional or like cultural like foods that you enjoy. Um, but a lot of people try to eat more like salads. They try to eat more like clean because they think they have this idea that if they don't, they're gonna get sick. Um, but yeah, I feel like this topic is just something that that needs a little bit more awareness. Especially how fast this information spreads on social media compared to accurate information. I feel like people love the drama, they love the controversy, and that's the reason why a lot of like accurate information doesn't really get seen as much.
I'd love to get your perspective on something. So, a lot of housing providers partner with the food bank, right? And so they have these community programs where they're offering food 1 day a week, and oftentimes, it's healthy foods, right? Vegetables, produce, sometimes eggs, and things like brown rice. Oftentimes, they're not very culturally relevant. And so, Southeast Asian families or Mexican families, they come and they get these bags of produce and other items, and then they just sell them on the street, right? And so, in a lot of ways, for me, when I'm seeing this, I like really feel like our health system is failing us, and I understand that it's like a great partnership, and it's really meaningful, and it's valuable, and it does put food in the hands of people that really need it. But when we talk about like being able to offer food that is culturally relevant and that you know folks know how to prepare, feel comfortable preparing, want to prepare. I guess my question to you is like, what can we do to improve, access to food, where we're really making sure that like we're putting food in the hands of people that need it, but also like being really mindful of like the choices that are available for folks.
Yeah, I think so. In Alameda County, I'm sure like in LA County too, or in San Francisco, there's so many different food pantries. And I think it mainly comes to promoting these resources, right? Because in Oakland, there's so many different food pantries that provide to, a lot of different like populations. Like, they'll provide to kids, they'll provide to families, they'll provide to the elderly. One of the organizations that I volunteer for is called Mercy Brown Bag, and they provide food, a food bag for, people who are 65 and older who aren't able to like move as much. And one thing that you do bring up is, the cultural aspect of the food that we provide. And honestly, I think that's just one thing that needs more work, because most of the food, like the produce that is provided to them, is, just stuff that's the basic stuff like tomatoes, like squash, stuff that's in season. So a lot of these families don't really know how to prepare that. And one thing that Mercy Brown Bag has been doing is they've been providing the bags, and they've also been providing like a nutrition education page with how to prepare like certain vegetables that they might not recognize. So how to prepare that, what type of nutrients it has, and some more resources like that. And I think, like we definitely need to continue working on the cultural aspect of things, because not everybody will use the same vegetables. Not everybody eats the same food. But it's definitely more about to, just trying to promote these different services. Because to me, like at the end of the day, I think it's more important that families have food on their table, and have access to at least something that they can make. And even though it might not be culturally, appropriate for them, they can still, find a way to use it. Um, and ending hunger is definitely like the bigger like picture for me, right? But yeah, like there's different clinics, there's different community organizations that also teach people how to cook and how to, live like, a healthier life. And I actually just started a job for 18 Reasons. I don't think I told Rogelio this before, but I started this job this week. And the main things that we do is teach like kids, their families, how to cook, and also give them a little bit of nutrition education on like basic things like my plate, staying hydrated, what kind of vegetables they should be eating, right? And organizations like this don't really have a lot of advertising, right? And people don't really know a lot about them, but basic skills like this are super important to like know, and they're very important for like preventative like care, especially like in low income areas, right? Because that's where we need this the most. The preventative care, the nutrition services, and like people are just not getting the services because they don't have the access to, the healthcare facilities. They don't have access to like clinics. They don't have access to service providers or like healthcare providers. So, you know, there's a lot of work to be done, basically.
Yeah, there really is. And I want to just acknowledge super quickly that there's also folks, like living in single room occupancies that don't have access to a stove. And so for them, there's added challenges
Mhm.
with being able to prepare nutritious meals for themselves. So
Yeah, and that's I was talking about, how a lot of people demonize processed foods, right? And this is another option for people who are not able to cook, right? They could purchase frozen vegetables, or they could purchase, canned products. Sometimes, these products are made to be healthier or like more nutritious compared to, a fresh vegetable, right? But people are like, oh no, let me stay away from like this canned product because, I heard online that it's, canned products or frozen products are bad for you, or they're highly processed. But in reality, that's another great option for people to look into if they're not able to, excuse me, like cook, and, they don't have access to a stove, or, the items that they need to like make, a plate, right?
Yeah, thanks, Ellie, for talking about that. And you know, um, we're very again, I'm very excited to have you on here and really, hopefully, spread more awareness to our listeners about you know what you focus on, and hopefully, integrating your perspective and some of the topics and words that we talked in the field that they work in. So again, we appreciate your time and you sharing your insights and knowledge here on this in this space. Um, so I just to wrap things up, I wanted to give you kind of the floor and just kind of maybe share your social medias. Also, if you can share a little bit on what would you say. We kind of like to end our episodes kind of saying like, what would you say to like a young planner or a young person in maybe in school trying to because we were there once in college and we're like, damn, is this really for me? And just any words of advice and really if anything else you would like to say before we finish.
Yeah. Yeah, I mean, anyone can find me on social media, under Eat Like Nutrition. Um, I have the same username on TikTok too, so it'll be pretty easy to find me.
Yeah.
Definitely, like one thing that I would tell, people in school right now is just try to, focus on something that you're passionate about. I think, for me, it took me some time to realize that I wanted to, work in the community and maybe work in policy changes and, address like food injustices, right? And yeah, definitely, try to like find something that you're passionate about because it'll make things easier for you. And basically, continue pushing it, continue like pursuing that because, people tend to give up, when things don't work out. But, I've been doing this for so long already, and, things are working out. I've been connected to different kinds of people, different organizations, and there's other people out there that, will support you. They'll support the goals that you have, and there's so many people out there just like you guys, like you found my page and we connected and we have like, similar views on a lot of different things, right? So, the community that we're building is growing, right? It's growing, and that's something that makes me happy because, when I started doing food injustice videos, I didn't really know, the type of person or the type of people that I was going to reach out to. And honestly, I've been getting so many different opportunities from it. So definitely, stay focused and, stay on the path.
Thank you. Blair, did you want to say anything before we leave?
No, I think that was a good way to end the episode. And yeah, it's been really good conversation. I feel like there's so much more we could talk about. And there's, again, we always talk about the intersectionality of urban planning and so many other fields of study. And so I really appreciate your perspectives and your personal experiences. And it's been, yeah, just really a lot to think about. So thank you so much.
Yeah, thank you, Ellie.
Yeah, I mean, thank you for having me. It's been great. Yeah.